We are continuing on in your anatomy chapter in the skeletal system, page 179, axial skeleton. All right, we separate the bones into two sections, the axial and the appendicular skeletons. This chart here talks about which bones are part of which, but I like the visual. The blue in this picture is the axial skeleton, skull, spinal cord, and that's it. The appendicular is the white bones, which are the collarbone, the clavicle, the scapula, which is your shoulder blade, and your arms, as well as the hips and all the legs. So everything that hooks onto the spinal cord is the appendicular. I keep this straight because appendicular is a long word and it contains the long bones, which are your arms and your legs. And so that's how I keep it straight in my head. You can see here, I've highlighted there that you have 206 bones in an adult skeleton, unless something has happened to make somebody lose some of those bones. So of course you could be born without an arm or a leg or foot or something, or you could have had an amputation along the way from an injury or a disease. But in a normal adult human, 206 bones. Yes, you need to know that. So I'm going to stop here and go to another slide. What bones do you need to know? These ones, okay? These are the most common bones, and I know this is not going to be a short list, but you have a lot of bones, and they're all kind of important. I'm using that same picture from your textbook that I just had up in your textbook. So your sternum, that is between the ribs, right here, the sternum. There's actually a name for the top of it and the bottom of it. The top is called the manubrium. The bottom is called the xiphoid process, spelled with an X, xiphoid. Little less important to know those ones. Then we have the arm. The humerus, the radius, and the ulna are the lower arm bones. The carpals are your wrist. The metacarpals are your hand. And the phalanges are the fingers that stick off of the hand. Okay. You have a number of carpal bones. You do not need to know the individual names. 8 of them, I believe. Okay. But if you go to work for an orthopedic doctor or a hand specialist, guess what? You're now going to need to know those. Okay. The word phalange is also used for toes, so you have to be really careful when you see that word, that you have to look at the context to know, does this patient have a finger problem or a toe problem? Because the word phalange on its own does not help. Phalange is also singular. That's the singular, phalanges is plural. Phalanx, I think, don't ask me to pronounce that one, is the singular version. Okay. You also have 2 bones for your lower arm, the radius and the ulna. You should know which side is which. This is how there's 2 ways I remember it. First, the ulna is the little word, so the ulna goes to the little finger. Okay, that's the ulna side of the arm. The other way that I know is that if you know how to take a pulse, you take a radial pulse and you do it on the thumb side of the hand, okay? You don't do it on the pinky side. Here's the center of my hand, and I do it on the thumb side, which is the radial bone on the thumb side. So those are the 2 ways I remember which bone goes on which side, okay? Those are your front and upper extremity. Oh, I'm sorry, I didn't do the scapula. The scapula is the shoulder blade. It's on the back side. And then the clavicle, I don't know why I don't have that on the slide. The clavicle is your collarbone that goes across right here. Okay. Next is the leg part. So the femur is the upper leg bone, the patella is the kneecap, the tibia and fibula are the two lower leg bones. If you look there, the tibia is the big one and the fibula is the little one. And then the pelvic girdle, the whole pelvis, is made up of the ilium, the ischium, and the pubis. Make sure you learn the spelling of the ilium, because you have another body part pronounced exactly the same, ilium, spelled with an E instead of an I. Where have you guys heard that before? Where have you heard ilium spelled with an E? If you said part of your small intestines, you're correct. Some of you haven't done that mod, so you're excused. But if you've done that mod, hopefully that sounded a little familiar. It's okay if it didn't. Okay. And then the skull itself. The mandible and the maxilla is your jaw. The mandible is the bottom jaw because the mandible manually moves. That's literally how I remember it. The maxilla is the top that does not move when you take a bite. Your skull has the frontal bone, the parietal bone, and the occipital bone. And then your vertebrae, and we're going to talk about this back in the chapter, is made up of the cervical, thoracic, the lumbar, the sacrum, and the coccyx, all of which we're going to talk about in the chapter because we have a lot more to say about that. But your coccyx is your tailbone. Okay. So I like to go through which of these bones should you be focusing on learning. So if you're a flashcard person, if you're a drawing person, however it is you need to do this. I had one student once who wrote on her small child with a black Sharpie marker. I don't suggest that. I'm not recommending or pushing that you do that, but she told me she didn't because then every time she changed a diaper or gave a bath, she was studying at the same time. I thought it was a little extreme, but it worked. Hey. All right, so the skull has a lot more bones than the ones I just went through that you need to know. Now, if you go work for a plastic surgeon, you may need to know all those, okay? We all have different levels. Hold on a second. I did not talk about the feet. I stopped at the tibia and fibula. The tarsals are the ankle bones. The metatarsals are the actual length of your foot, and then the phalanges are the toes sticking out at the end. Same word as with the hands that we already talked about. Sorry, just dawned on me I didn't talk about feet. I love my podiatrist. I forgot the feet. Okay. Not only do you have those skull bones, you also have a bunch of facial bones. Again, depending on where you go to work. So you have nasal bone. The zygomatic is your cheekbone. I kind of like that one. Mandible and maxilla we did talk about. The palatine is the roof of the mouth. The vomer is kind of like inside the nose. And then you have three tiny little bones in your ears called the malleus, the incus, and the stapes. You learned that last module if you were here when we did the ear. And the hyoid bone is one in your neck. It just kind of like sits on your trachea. And it's one that they look at if they think that the person might have been strangled. They look at the hyoid bone. It's one of those telltale signs of a strangulation. Okay. All right. That's the end of this video, and we will pick up here with video 3.